right, this is how to prime tubing for an IV. So when you're hanging IV fluid, it's just like giving a medication. It is on the medication administration record, the MAR. And so to start off with, you would get your bag of IV fluid and you will do your first checks at the nursing station or with the rolling computer. You will also look at the bag, make sure that the bag's intact, and if the bag has an expiration date, you're going to look at that expiration date as well. And then most nurses do prime their tubing at the nurse's station. We are here at the patient's bedside, so we're going to prime the tubing here at the patient's bedside. You will also have some IV tubing, some straight tubing. There are all different brands of straight tubing out there. This does not look exactly like the one that's in your bag, I don't believe. But what you would be looking for is primary set. All right, it's going to just show this is not tubing that goes through the IV pump. You would hang this by gravity. You'll also need a flush because we're going to hook this up to our IV, a pair of gloves, and some alcohol wipes. So I'm going to come to the patient's bedside. I've done my first 2 checks. I'm going to knock on the door, wash my hands. I am going to ask our patient his name and date of birth and scan his armband. I'm going to scan the IV bag. It has a barcode on it somewhere. And then I'm going to do my 3rd check at the computer. This is IV fluid that is 0.9% sodium chloride. My order says to run it at 100 milliliters per hour continuously, so now's the right time to do that. All right, and then I am going to put on gloves. Anytime we're working with IVs, you must wear gloves, even though you see different things in your practice. So before I do anything with the IV, I'm going to look at the IV site. I'm going to make sure that the site looks okay, that there's no redness or inflammation, that there's no swelling or coolness, which might indicate infiltration, and that there's no leaking. So I look at my site, that looks good. So here's my bag. I'm going to open my bag. Usually there's a perforation somewhere on this bag, and then you open like this. So I see the little perforation, it's right there, and I open the bag like that, throw out my garbage. Your bag might look a little bit different right here where you spike it. Again, it's just a matter of what brand, like Kleenex or Puffs or the Target brand. All right, I'm looking at my container here with my tubing, and I see here's where it's perforated right here because I don't want to struggle with that bag. It's very easy if you use the perforation. And then as soon as you open this up, clamp the clamp. If you don't clamp the clamp when you spike your bag, you'll get a bunch of air. And then there's these little pieces of paper. You can just tear them off. They're just an indication that the tubing has been through the sterilization process. And I'm going to take my bag. Now, you can hang your bag up here and then spike it, or you can hold it in your hand and spike it. I find it hard to do hanging on the hook. It doesn't matter. What matters is don't contaminate the spike. All right, so I pulled the cap off of the bag. I pulled my spike off, the cap off the spike. I cannot touch that spike. I have to spike the bag. I'm pushing and turning. So I push and I turn. I'm turning and pushing until the spike is all the way in there. And now I'm going to hang my bag on the hook. And now I need to prime the tubing. So I start by right here at the drip chamber, filling that about halfway full. I want it full enough so that it doesn't allow air to come in, but not so full that I can't see it dripping. I want to be able to see the drops. And then right here where the roller clamp is, I'm going to start the priming process. I want to make sure when the fluid gets to each one of these wide ports that I'm holding them upside down, because otherwise air will collect right there, and then when you hook up a piggyback or something, that big air bubble will come right down and into your patient, which we want to avoid. And if it's pump tubing and you're running through the pump, it will make your pump alarm, 3 minutes after you leave the room, which is very annoying, right? So I am holding this Y port upside down. I am opening the roller clamp, slowly opening it. And now I'm watching the fluid as it's coming down. All right, so I had this Y port upside down. I can let it go now because my column of fluid is right in here. So sometimes when the fluid gets right to the roller clamp, you have to loosen the roller clamp a little bit more. So I loosened it a little bit. Here's the fluid, it's right here. It's traveling down the tubing. You have to take your time, otherwise you get a bunch of air. And then it's very hard to get all those air bubbles out. Now I'm holding these Y ports upside down. Here's the fluid right here. It's coming down. All right, I'm holding that Y port upside down. Here it comes right here. It's right here, right at this Y port. All right, that's good. Here it comes. And obviously, if I hold the tubing up here, it's going to go slow. Or here, it's going to go more quickly because it goes by gravity. Here comes the fluid. You see, I'm taking my time. You cannot go super fast with this. You end up with your whole bag of IV fluid in the garbage can. Here comes the fluid. Here comes, it's right here. You see I'm holding my Y port upside down. All right, and then when the fluid gets to the end, then I can use the roller clamp to clamp it. Okay, many times you see people priming IV tubing, and they might hold it over a sink if you're in the nurse's station, or it is okay to hold it over a garbage can, but you cannot put the tubing in the garbage can, right? That's not very sanitary or clean. Remember, this is getting hooked to somebody's IV and putting fluid inside their body. So you should never see tubing like sitting in a garbage can. That's not appropriate. All right, now I'm going to do a double check. I'm looking at my tubing. Do I have any big old air bubbles anywhere that I need to be concerned about? I'm checking it over. That all looks fine. And I can loop my tubing up here while I get ready to hook it up to the IV. Or there's this nice little thing right here on the clamp. You can stick the tubing right there too. It doesn't matter. All right, so now I have a saline flush and I have an alcohol wipe. So I already assessed my IV, but I am going to flush the IV and make sure that it is working properly. So I take this out of the little plastic. This is not sterile inside of here. And this little flush, these little flushes, they're sealed. So when you open them up, when you want to unseal this, if you push the plunger too high, it will send saline up and hit the ceiling and put stains on the ceiling. So don't do that. What you can do is just pull it back a tiny bit and then it will break the seal. Give it a pull. And I'm going to take the cap off and try that again. Give it a little pull to break that seal and then push that air out that's in that flush. All right, so I push the air out. Remember, that's got to stay sterile because that's going to connect with the IV. So here's his IV. I make sure it's unclamped, which it is. I clean this off. I'm doing a vigorous cleaning all around the hub and the threads and everything. To connect my saline flush, I have to take the cap off. See, I took the cap off. This has got to stay sterile. In order to connect it, I push and turn. So I'm holding it, I push and turn, and then I pull back a little bit, and I hope I see a blood return. If I see a blood return, I am so happy because I know this IV is in his vein and it's working correctly, and I can flush, and I feel it flushes in with no or little resistance. I'm so happy it's working right. Sometimes you come, you hook it up, and you pull back a little bit, and you don't get a blood return. So maybe you pull back a little bit more, while you still don't get a blood return. Well, does that mean you have to take the IV out? Not necessarily. Sometimes you just don't get a blood return. So I didn't get a blood return. I go ahead and flush slowly. As I'm flushing, I'm watching the site. Do I see it swell up, like the fluid is just going in the tissue instead of in the vein? Do I see it leak out at the insertion site? I don't see any of that, so I know my IV is working well. I'm going to watch this one carefully though, because I didn't get that blood return. The blood return makes you know for sure you've got the IV in the right place. So then you can feel super confident. With this, it flushed well and it looks fine. It's not red or swollen. You can feel fairly confident. So I take my flush out. The flush goes into your sharps container at most facilities. And now I'm going to hook up my IV. So I'm going to hook up my IV right here. Alright, so I cleaned that at the hub. I had to take the cap off of this. I hook it in here. I have to push. And then there's a little collar here. You have to push and turn. Alright. Now, once your IV is in place, I'm looking for all my garbage here so I can throw my garbage out. It's always nice not to leave a bunch of garbage in your patient's bed, right? Alright, so now I need to figure out my rate by counting these drops right here. So the way that I figure out the drops is on my package. It told me that this tubing has 15 drops per milliliter. So I have to do the calculation, which I'll show you in a different video as to how to do that. And then I use the second hand on my watch. I very slowly open the roller clamp, and I count the drops for 15 seconds. So say I'm supposed to get 21 drops in 1 minute. How many drops would I need in 15 seconds? Well, then I would need about 5. So I would use my second hand on my watch. I know many young people today do not wear a watch anymore. You use your phone, or you have a digital watch. You can certainly set your phone for 15 seconds, or you can set your watch for 15 seconds. And then as you're watching your watch, you're counting these drops until you get about 5 drops per 15 seconds. All right. So I would need to adjust this a little bit. You use the roller clamp. You might need to make it go a little faster or a little slower as you're counting. Right? What's important about this is you can't count the drops before you hook it up, because once you hook it up, there's some resistance in the patient's vein. So you can't just hold it over the garbage can and count the drops and then hook it up, because I guarantee you will run more slowly once it's hooked up. So counting the drops occurs at the end, after you've checked the IV, after you've primed it, after you've hooked everything up. That's when you count the drops and make sure that it is running at the right rate. So many of you are thinking to yourselves, you work in a healthcare facility, maybe in an acute care or a hospital, and you never see IVs hung like this by gravity. You usually see the nurses using a pump. That is correct. Many times they do use a pump, and so you will learn how to use the pump. However, there are cases where pumps are not used. For example, in the preoperative holding area, in the operating room itself, many times they're not using pumps. In their special procedures area, like where they do colonoscopies and endoscopies, sometimes in the emergency department. So in all those areas, they are not using a pump. And so you need to know how to manage fluids by gravity like this without a pump. Okay? All right, so just to recap, right? IV fluid, like a medication, you have to do the 3 checks and all the rights, including the scanning. When you take your tubing out of the package, you need to make sure that you clamp it first thing. Don't forget that, because the whole thing will be messed up if you don't do that. as you're priming, letting the fluid run through, you're using the roller clamp to adjust it. You're going to turn each Y port upside down as the fluid comes to it. Once the whole thing is primed, you've got fluid through the whole thing, there's no air bubbles. You're going to flush the IV, hook it up, and after it's all hooked up, you're going to count the drops to make sure that it's going at the correct rates. And that is all for priming your IV.